A former NFL quarterback and Gamecocks star, once known as a dual threat for his ability to run and throw. But at the age of 34, the threat became his life.
So I'm making my way over to our sideline to talk to our assistant coach and like, hey man, I'm not feeling good. Hand him the playbook. And that's when I collapsed into sudden cardiac arrest.
A stranger coming to the rescue to save him.
So you were doing CPR for 5 minutes?
Yes.
That is a long time
It's
to do
a very long
CPR.
time for CPR, yes.
Yeah.
What do we know right now with somebody who might appear to be perfectly healthy, an athlete, who just ran a race and then all of a sudden goes into cardiac arrest? What do we know about why that could happen at this point?
If you're a young athlete, we worry quite a bit about genetic conditions.
Welcome to the Wellness Files, a podcast where we explore practical tools, research, and real stories. I'm your host, Kari Beal, and today we're sitting down with Connor Shaw, the man who saved his life, Caleb Carter, and then we hear from cardiologist Jonathan Kim.
So Connor, I'll start with you. Just say your full name and your title.
Connor Shaw, former football player. I'm Caleb Carter, training officer for Simpsonville Fire Department.
So Connor, I kind of want to get right to it. Take me back to the day when we were on this field. So we're on a field in Simpsonville, Gracely Park, and you were on this field, and what do you remember?
Yeah, it was September 17th, coaching my son's flag football game. It was early in the game. Our offense had just scored. And coaches in this league can be quarterbacks. So that was a lot of fun for me. And so I had just called a play and started to feel nauseous and dizzy for about 20 seconds. And then we had just scored. So I'm making my way over to our sideline to talk to our assistant coach and like, hey man, I'm not feeling good. Hand him the playbook. And that's when I collapsed into sudden cardiac arrest. My wife, kids were there. And sudden cardiac arrest is an abrupt loss of heart function due to an electrical malfunction. And, if not treated with immediate CPR and an AED, you die within minutes. So very fortunate that I was here at Gracely Park to have the emergency response and AED at Simpsonville Fire. But more importantly, who was there, with Caleb and Zach, who was on the field right beside me, who rushed to my aid immediately and gave me a chance to survive it. But scary situation for everybody.
Caleb, what do you remember from that day?
So I was on this field coaching my son's team. I called a play for our offense and stepped on the sideline, and one of the moms on the team told me, hey, that guy over there just collapsed. You want to go check on him? And when I got over there, it was Connor, and he was not quite into cardiac arrest yet, but through experience, I knew it was coming in a hurry, and Zach was already there helping. I said, hey, he's going to go into cardiac arrest. Be ready to start CPR.
What does that mean? Like, what does it look like before someone goes into cardiac arrest?
Well, so it could look different for everybody, but for Connor, it's very shallow, ineffective respirations where he was trying to breathe still, and a very rapid and thready pulse. Just ineffective. The body's trying to compensate for some things going on. It can only do that for so long before it gives up.
And then what did you do?
So once he went into cardiac arrest and lost the pulse, we started CPR. I had one of the bystanders on the phone with 911 to get more help coming. So we started CPR, and it was about 5 minutes before other responders got to us, and we got AED on.
So it's 5 minutes. So you were doing CPR for 5 minutes.
Yeah.
That is a long time to do
It's
CPR.
a very long time for CPR, yes.
Yeah.
Yes.
And were you the only one who knew CPR on the field?
I think Zach knows CPR as well, but
Maybe you were the most trained.
an ego or what have you, but I wanted to do it because I knew I could do it at a high level. So I just stayed on with compressions.
And then after about 5 minutes, more emergency crews got here and they had an AED. Can you explain what an AED is and why that helps somebody going through cardiac arrest?
Yeah, so AED stands for automatic external defibrillator. And so if someone is experiencing a ventricular fibrillation, which is just a dysrhythmia of the heart, it's an electrical impulse that's not an effective pulse to circulate blood through the body. The AED will deliver a shock that disrupts that rhythm and ideally would help the person go back into a normal sinus rhythm, normal heart rate. AEDs are very important in out of hospital or in hospital.
Do they always work?
Not always.
Okay.
It has to be a shockable rhythm. So AEDs work on ventricular fibrillation and ventricular tachycardia, the two rhythms that can be shocked, which are most common in cardiac arrest.
Now, does someone need to be trained to use an AED?
No, AEDs are actually designed for about a 5th grade
Okay.
level person to operate. They are voice prompted and kind of walk you through everything. Pictures for where to place the AED pads.
So when you they started using the AED, did that bring the rhythm back?
I think after the 3rd shock that was delivered, we got kind of got back into normal sinus rhythm.
Okay. How did that feel?
It's always a relief, right? Well, it's a relief anytime the AED says shock advised, which means that there is a rhythm that is treatable. So you always have a chance anytime it lets us shock somebody.
Now, you guys didn't know each other. No. At this time. Did you know who he was, Caleb?
Yeah, so I went to the University of South Carolina, big Gamecocks fan, of course. Everybody knows Connor Shaw if you're a Gamecocks fan, right? So I did recognize him after we were down there.
What was going through your mind at the time?
Honestly, it was a person that needed help. It wouldn't have mattered really who it was. But knowing that it was Connor Shaw, I had a good guess at his age, which also helps with survivability. So I knew I wanted to work hard and do the best we could.
Connor, did you have any signs that this might happen before the event?
Other than the 20 seconds of feeling dizzy and nauseous, no. The day before, I'm running 20 half gassers. I've never stopped training.
What are half gassers?
So we're on the football field right now. Half gassers are running across the field and back, so 52.5 yards. And that's just something that we used to do when I was a player, and it's a great way to train. But anyways, I've always been very health conscious and enjoyed working out and training, and I've never had issues from most of my adult life being the former athlete. I've had echoes and EKG tests. I don't have any underlying heart conditions. I've had, post genetics testing since this incident. And so, there is still some exploration of the why behind it, which can be frustrating, but also there's silver linings in that as well. I don't have any heart disease or where it's going to be passed down to my kids. But to answer your question, no, this was just a very sudden thing.
So we don't know at all why it happened.
No, there are some theories, but from my understanding and what was told to me, the heart's a very mysterious thing, and it can just vary with a lot of people. And I've been referred to a cardiologist in Atlanta who works with a lot of the professional teams there, who has taken my case, very interested because of the link to athletes and sudden cardiac arrest. So I'll be meeting with him shortly and doing a deep dive and learning from his perspective and insight. But yeah, I don't know that I'll get a definitive answer. I do have a device made by Medtronic, so thankful for new technology, new medicine.
And what is that device?
It's an internal defibrillator, so very different than a pacemaker. I guess not very different, but there are some differences. So a pacemaker typically sits on your chest and it goes into your heart, where this EV-ICD sits underneath my armpit and the lead goes underneath my sternum, and it monitors the electrical pulses. So for whatever reason, there's an electrical malfunction, it would send the pulse, and if I were to go into VFib again, then it would shock me. So
it's almost like having an AED in you.
Yeah, which there is peace of mind that comes with that. I was very stubborn and didn't want a device in me at 34 years old. I just thought it was really bananas that we're even having that conversation in the hospital. But it gives my wife, my kids peace of mind, and I can get back to working out and getting back into some sort of normalcy, knowing that there is some protection there.
I want to rewind a little bit. So you said there's a cardiologist in Atlanta that thinks there could be a link between athletes and cardiac arrest.
Yeah.
What does that doctor or researcher tell you?
Not a whole lot, just that there is, as a matter of fact, over the past 5-6 years, there's been a direct link with athletes and sudden cardiac arrest. And by no means is this limited to athletes. I mean, this applies to anyone and everyone, and it affects over 400,000 people a year. But I think that he is very interested in that correlation. And again, I don't think it's a one size fits all with athletes. People have genetic heart defects sometimes, and that could play a part in it. They just happen to be athletes. So,
Or go missed. There's a lot of people that have a heart defect that they never catch until
100%.
they have an event.
Heart screenings are important. That's something that Hrthudle is going to be doing for young athletes, especially. But yeah, my case is very peculiar because there's just not a definitive answer when they were looking at MRI tests and all that. And to be quite honest, the only explanation that I have from that is that I was chosen for this. That I have a platform and some namesake, and I want to embrace this story. It's not easy talking about what happened. It's not easy being here, reliving that, but I see it as a responsibility, and also an opportunity to embrace it, to leverage it, to help save more lives. I've had so many people reach out since my incident, sharing similar stories, and also heartbreaking stories. Less than 10% survive sudden cardiac arrest. So there has to be the right timing and the right people there, and people that are trained and know what they're doing. And I believe that everyone deserves the same opportunity to survive that I was given. And that's why we're having this conversation today. And that's what Hrthudle will be doing here soon.
And I'll ask about that initiative in a minute. But I also want to touch on how an event like this can impact a family. Your wife, she was 7 months pregnant?
Yeah, even more.
the time?
I think she was about a month.
She was maybe 8 months pregnant at the time?
Yeah.
What was going through her mind when all this happened?
Yeah, very sobering to hear her story. Of course, I was in and out of consciousness, but my wife was sitting on that bank over there. My kids were here. She was chasing around my 2-year-old. My son was playing. My 11-year-old daughter was here.
So a lot of your family.
All my family. My mother-in-law was here, thankfully, because she was able to help support the kids during that whirlwind. And also my kids that I was coaching and everyone involved. Like that could be a very traumatic scenario and very confusing. So after the incident, we just kind of sat in it for a week and really tried to process it. There's no playbook of mentally how to move forward. What just happened. It's one thing to be sort of cleared and in the clear physically, but mentally it's a life-altering event. And certainly my family. Now, I'm so proud of my kids because they're so resilient. And I think the first thing was, Dad's okay, after the first couple of nights in the hospital. And that gave them some confidence. It's quite the reunion coming home from the hospital. But, my wife still has her moments, and so do I, of just the overwhelming sense of gratitude and how close I was, not to meet my new son last Monday, and have my kids go through life without a dad, which is just a real thing, but also, very thankful. And it was a miracle that I was able to survive it.
How did it impact you emotionally? Are there days where you're still like, wow, I'm here?
Yeah, well, it feels like a fever dream sometimes. The further I get out from the incident, is like, gosh, did that really happen? And again, I've been healthy for all my life. And so I never would have thought this would have happened to me. I think most people think that, something that you would see on the news channel or read about in an article states away. But, after this, it comes with a lot of questions, and a lot of that's thinking about purpose and, why I'm still here and God's plan for this. And through a lot of prayer and, like I said, a lot of people reaching out, I think that a lot of good will come from this as well. So it's been healthy for me to be able to channel a lot of those emotions and that emotional roller coaster into a mission, which, I'm excited to kick off here soon.
Have you changed anything in your lifestyle since the event happened? Or is it harder to do anything? Like,
no, it's certainly
breathing?
No, I guess Caleb and I were talking about this, but the month afterwards, it's hard when you lay your head down at night and you hear your heartbeat. And
you can hear it?
Yeah, and it,
is that because of the device, or is
when you just press against a pillow, or you naturally, because I'm thinking about it, you start to hear the rhythm of the heartbeat and that pulse. And I've just a little bit of PTSD from that. And so when it feels like it's out of rhythm, it's like, oh shoot, what's going to happen? Checking in with the people who monitor my device frequently after those first couple of weeks of just, is this something that's going to happen more often, or am I more susceptible now that it's happened once? So just, again, a lot of questions came from it, but I'm pretty much back to normal. I'm training like I used to train. I'm not the type of person that lives in fear. I've always been a resilient person.
And it comes to being a football player.
Yeah, I've been conditioned.
Yeah.
I think so. And to be able to compartmentalize, but of course I have my moments, but I'm also not one to live in fear. And we're not having this conversation to seed fear and doubt for anyone listening to this, but it matters to be prepared.
Mm-hmm. Do you think maybe when you collapsed, you heard your heart beat or something? I don't know. I'm just wondering why that, all of a sudden that you feel like you can hear it.
Well, I only hear it when I'm like pressed against a pillow, or like, I'm sure if you did it too, you could probably hear your own heartbeat. It's just never had the reason to pay attention to it. And so I had a reason to pay attention to it, and it's hard not to. But a lot of we're back into a good rhythm and routine. But it's something that I don't want to forget. I don't think I think it's a healthy thing to step back into things, not feeling like the used to be normal things are not normal anymore. And I think that's okay. This is supposed to be a life-changing event, and that's the way I'm approaching it. And again, I'm answering the call here. I feel like I'm chosen for it.
Yeah. You said you have a little bit of PTSD from the event. How do you process that?
Talk about it with my wife.
That's what you encourage other people to do if they experience something similar?
100%. I mean, the last thing you want to do is feel like you're on an island, and it's easy to do that when something like this happens, because it doesn't happen to a lot of people. And I certainly didn't know of anyone personally that went through sudden cardiac arrest or any sort of.
At least at 34, right? Who was doing, as you said, those sprints the day before.
Right. So, but again, a lot of people reached out. Hey, with a similar story, people in Tennessee and Florida and on the West Coast, and former athletes like, hey, I'm a marathon runner. This happened to me when I was training. And so there is some comfort that comes with that, to hear other people's stories, to hear other survivor stories. And also there's a lot of gratitude that comes with hearing the heartbreaking stories, because that's sobering. And to realize that, not everyone survives it. And he'll, less than 10%.
If you don't have someone like Caleb next to you on the field, ready to go, and then an AED.
Yeah.
So let's get on to that. You have this whole campaign with AEDs. Tell me what you hope to accomplish.
Yeah. So Hrthudle exists to equip communities to respond to sudden cardiac arrest. And that's a twofold thing. Leaning on Caleb's expertise and his counterparts in South Carolina on the hosting CPR instruction events. I mean, he lives in this world every day. And what a valuable skill set and person to serve on the board, not only because he saved my life, but the value that he's going to bring to this mission. And then also to purchase and place as many AEDs in areas of need as possible. And I know there are some mandates, like there has to be an AED in high schools and maybe middle schools, but to have an AED in a school building might be 8-10 minutes away from a tennis court or a football field or a basketball court.
So you want one right here, at the very least on this field. We don't have that yet, right?
Absolutely. There's one up there in that firehouse, the fire department.
Okay.
But you certainly want an AED placed inside 3 minutes of any sort of competition being hosted, because it's a timing game.
Is your goal to get them onto as many fields as you can? Obviously, they're on college, high school fields, but maybe more than that. Recreational kids, who are playing, sort of thing.
Yes, to answer your question, all of it, all the above. Middle school fields, high school fields. There's a little bit more attention on high schools, so maybe there's more areas and needs in rec departments, and focusing on some of the pockets of South Carolina, like the I-95 corridor, where it's hard to get funding there. And we have a lot of great partners in the background that's going to support and be an engine for Hrthudle to be able to assess those areas. And already, large AED suppliers and distributors have reached out wanting to support. And, again, having Caleb's expertise and insight on different models and communicating with his counterparts around different communities in South Carolina, and supporting even police departments and putting those in police cars where oftentimes they're not found. And, they're being dispatched. Oftentimes they're the quickest to the scene. So, we have a lot of goals and projects that we're going to focus on, but there's going to be an immediate impact from placing AEDs even before this year's over. And again, thankful for the people reaching out wanting to support it. And Hrthudle is going to thrive with a generous giving of people wanting to support it too. Corporations and people is no different than any other nonprofit. And this is as neutral of a cause as possible. This is a matter of life and death. And I think everyone can get on board with saving more lives and having more people equipped to do that.
And how are you guys now? I mean, you're friends. You were strangers before. Would you say you've developed a friendship now?
Oh, certainly. Yeah. I mean, a lot of respect for what he does, number one, for a living, and for what he did for my life and my family. But, very grounded, humble person, thankful to call him a friend, and really excited to be working together with this mission. And I think who knows how big it can get. This is a grassroots, organic approach here. And I think that's the way it needs to be able to really be intertwined in communities and know those communities and know those people and know where they need to be. And, something that not just, hey, you hear my story because people know who I am, and it's a shot in the arm where it's a one-hit wonder. Like, this is going to be built to sustain, because sudden cardiac arrest is not going anywhere. That's a problem that's sustained, and it's going to take people that have a heart like this and to make some change and increase survival rates. And that's the goal.
Yeah, for sure. And is there anything you want to say about knowing CPR too? Because I understand that is very important as well. I mean, Connor wouldn't be here today if it wasn't for someone like Caleb knowing CPR.
So he touched on it. It's about 350 to 400,000 cases of out of hospital sudden cardiac arrest happen every year.
Yeah, happen out of the hospital, right? Yeah.
And it's less than 10% survivability rate on average, national average. When a bystander is there on scene to do CPR immediately, that you're 3 times as likely to survive. And then when an AED is on scene within 3 to 5 minutes, that number goes up to about 70% survivability rate. So it's huge. It's a massive impact. Having people that know how to do CPR and are willing to act and to do it quickly, it's the biggest predictor in outcomes is how quick high quality CPR started and how soon an AED can get in place.
Caleb, what do you want people to learn from this story?
To equip yourself with taking a simple CPR class and having the confidence to know what needs to be done and when to do it, so that if you find yourself in that position, you can act and hopefully have a positive impact on somebody's life. It's got to be an awful feeling to witness this and not know what or to do or how to help.
What happened?
I think most people inherently want to help when they see things happen. Equip yourself to help. Learn CPR.
Yeah, right. Connor, any other advice you have for people who might have gone through something similar, whether that's the person themselves or the family?
I guess to echo on what Caleb just talked about, I think that's the most important thing is being able to administer CPR should just be a basic life skill. And I think some people are reluctant because they're just not prepared or even afraid to hurt somebody in those moments. Was it 2 inches of the chest?
2 inches, so compression, yeah.
And about 100 and 120 compressions per minute.
I heard the tip, you sing the song, Staying Alive.
Yeah. It's a little bit faster than that now, yeah. So we're trying to shoot for 100 to 120 beats per minute.
Maybe a faster song. Yeah. Is there a song you like to sing?
No, I can't tell you. I don't.
Okay.
I practice so much with metronomes, so just like clicking.
Okay.
I'll say this, I had a couple broken ribs, and that's a sign of proper CPR training.
It's tough. I mean, you have to literally get on top of them, right?
Right. So good CPR is very invasive in nature, and it can be visually disturbing, but 2 inches of compression and a full rebound, tiring. And then about 120 times a minute. That's close to twice every second. It's invasive is a good word for good, high quality CPR.
I'm an example of it could happen to anyone at any time. So there is a stress the importance of being trained. And I would be remiss to say if I didn't mention this too, because I'm a believer, and I think all things can happen for good And I do think a lot of good will come from this. And the overarching mission of Hrthudle will be glorifying the name of Jesus in every survivor story, because he is a God of healing and a God of miracles. And I reference Mark 16:15, where you go preach to all creation, and Hrthudle is going to be a conduit to do that, and hear about more survivor stories, and to praise his name because of it.
Well, thank you, gentlemen, for doing the interview and sharing both of your stories. I think a lot of people can learn from them.
Thank you. Thank you for the opportunity to share it.
As you heard in that story, Connor mentioned a cardiologist who he plans to talk to, who is looking into athletes who experience sudden cardiac arrest. And that is who I got the chance to talk to, Dr. Jonathan Kim. He's from Emory University and Emory Healthcare, and he said he couldn't talk specifically about Connor's case, but he could talk about cases in general. So here's his interview. So we are here with Dr. Jonathan Kim, and he is the Director of Sports Cardiology at Emory Healthcare. So thank you so much for joining us today.
Thank you so much for having me, Kari. Look forward to the discussion.
So let's go over some of the research that you're doing on cardiac arrest and athletes. I just want to kind of get a generalization of what you're studying and what you hope that we can all learn from it.
Well, sudden cardiac arrest and death in athletes is a primary area of interest, passion, as well as just clinical expertise in sports cardiology. So a lot of my research is focused within numerous aspects within the field of sports cardiology. And while I'm not focused so much specifically on sudden cardiac death in athletes, we have a lot of different projects and areas of interest, pieces that we publish that certainly are related to this topic. It's a massive topic overall as well. And certainly we can talk about really anything you'd like as it relates to nuances within this really important topic.
What do we know right now with somebody who might appear to be perfectly healthy, an athlete, who just ran a race and then all of a sudden goes into cardiac arrest? What do we know about why that could happen at this point?
Sure. The first thing to keep in mind when we talk about a sudden cardiac event in an athletic individual are a few things, actually. First, the epidemiology, and this is very much an age-dependent issue. What I mean by that is, for somebody who may be young, such as a young athlete in high school or college, 16, 17, 18, et cetera, the differential diagnosis as it relates to the most common causes are going to be different compared to an older individual, say 35 years of age and above, and what their most common risks may be whenever engaged in sports and having a sudden cardiac event. If you're a young athlete, we worry quite a bit about genetic conditions. So these are genetically inherited conditions, whether they are structural heart conditions or structural heart rhythm problems that are inherited. They're due to underlying mutations that then ultimately manifest to the development of a specific disease process. These are the more common causes of sudden cardiac arrest in an athlete. And sometimes there can be acquired conditions as well, such as something called myocarditis after an infection. Sometimes that inflammation can affect the heart. So these are acquired issues. And those can actually affect older individuals too. But for the young athlete, we think about these three different bins. For the older athlete, while we still certainly can think of these conditions, and you should, the most common cause of a cardiac event in an older athlete is what's called coronary artery disease. So for the layperson, somebody having a quote unquote heart attack, a blockage in the arteries, and one of those arteries that supplies blood to the heart. For patients out there who have blockages, these are the patients who have stents put in, or if they've had a heart attack and have a stent put in. As we get older, coronary artery disease is just that much more common. And so that generally is the more common cause. So this is generally how an otherwise healthy person can have this happen to them, because sometimes you don't even feel symptoms beforehand. And this can be true for a young athlete with one of these genetic conditions, and actually even an older athlete who may have underlying coronary disease. Sometimes the first manifestation of the problem in the disease could actually be a cardiac arrest.
Could somebody who's healthy Like they can run, they can exercise, all that. Could they still have coronary artery disease? I mean, I think you think of that as somebody maybe who's overweight or has high cholesterol and like their body just isn't healthy, but could that happen to somebody who's healthy?
Absolutely, 100%. This is how the field of sports cardiology really, in some ways, almost exists. We take care of a lot of young athletes who have issues that arise, but most of the patients who come to see a sports cardiologist are actually recreational older athletes, marathon runners, triathletes, cyclists, you name the sport. Exercise 100% is medicine. Everybody should exercise. If you exercise, you lower your risk of heart disease and coronary artery disease. But as we tell all our patients, exercise isn't a entirely 100% protective phenomenon. It's not a quote unquote vaccine for coronary artery disease where you're going to prevent this from happening. Could be due to underlying genetics. There's a family history of coronary artery disease is certainly out there. Could be due to uh, behavioral habits, a bad diet, a prior history of smoking, things such as that. And again, some common risk factors out there in the general population, such as high blood pressure, high cholesterol, those still exist, even for those individuals who may exercise a ton, who may be highly competitive and winning these type of events. And so all of that has to be taken in consideration when you're counseling this type of individual. But anybody who's engaged in these habits should ensure that, hey, just because I exercise a ton doesn't mean that you don't need to see your doctor. Doesn't mean you need to see a cardiologist per se, but you should 100% see your regular doctor, making sure your blood pressure is good, talking about all of these specific risk factors, because some of these individuals may actually be individuals where more aggressive primary prevention should be considered and pursued. So yes, for the older athlete, even if you're an athlete, it doesn't mean that you couldn't possibly have some of these things happen to you. It's why it's so important for athletes out there who are older to know this and to make sure that they are being heart healthy, eating healthy, taking care of themselves, watching their blood pressure, and absolutely please see your doctor on a regular basis, like we all should.
Now, is there ways to prevent that? Like, I guess with eating or, obviously exercising, if they're exercising, they appear to be an athlete, they're doing that well. But yeah, are there ways to prevent it, with eating?
I think the short answer is there are certainly habits to engage in that can either delay the process, potentially prevent, I suppose. But there is a genetic component to some of this. So this is why we always ask this question in the clinics to any patient, whether you're an athlete or not. Do you have a family history of early coronary artery disease? Did you have first degree relatives who had heart attacks or stents put in when they were in their 40s, 30s sometimes even, because that suggests that there is an underlying genetic predisposition. But beyond that, to what you were just asking, eating healthy, ensuring that your blood pressure is normal, those are the ways to potentially delay the process. It may not prevent this. Almost all of us will develop some degree of atherosclerosis as we get older. It's just the nature of getting older. But addressing these factors is really important because high blood pressure is just so common out there, and that certainly has a very strong genetic predisposition. Um, and I want all of your listeners, though, to remember that what we're saying here is we shouldn't be scared of this if you are an athlete. It just means that all of us potentially, some of this could happen. It's very common. And we need to ensure that we're addressing all these specific factors. And exercise is really important. So, what I said earlier, exercise is medicine, is an important take home point. Hopefully, no doctor out there is telling a patient, whatever condition they have, you should not exercise. There's always some degree of a healthy exercise prescription for all of us out there. And it's very true that for individuals who have some of these cardiac risk factors, having high, what we call cardiorespiratory fitness, what does that mean? It just means that you're well conditioned and in shape, you regularly exercise. That 100% is protective as it relates to heart outcomes, so dying from heart disease, but also the development of these conditions. So it's not just healthy for mental health, for the heart. Exercise is really helpful for numerous systems, and hopefully everybody's engaged in some degree of exercise, regular routine exercise.
So, are there like tests that you can have done? Let's say you're an athlete and maybe your parent had cardiac arrest or something. And so you're worried that it could be, in your genes. Are there tests that you can have done to examine that?
It's a great question. It's very much dependent on what's in that specific athlete's history. So there are clearly certain inherited conditions where you would do more aggressive type, to your point, testing. There can be some screening tests that can be employed. But again, it is relevant to a potentially specific diagnosis that may be within the family. What we say for all young athletes out there is there should be a baseline history and physical as part of what we call the pre-participation cardiac evaluation. So all student athletes who, before they participate in sports, high school sports, should be having one of these checked off. This is certainly endorsed by American Heart Association, American College of Cardiology. And within this history and physical, the practitioner asks certain questions. They want to know if you're having certain concerning symptoms when you exercise. And they actually do review a very specific family history for all the genetic conditions that we worry about. So it's a very specific type of family history questionnaire that we go through. And then a physical exam, a cardiac exam, listening for murmurs, doing other specific parts of the exam that may clue into somebody who may need more testing. We always say as well that the history and physical is part of the cardiac history and physical is part of this pre-participation evaluation is really important because it also just affords an opportunity for a young person to see a doctor. And sometimes, particularly for some youths out there who may come from an under-resourced neighborhood, maybe they never had a chance to see a regular doctor growing up. This is an opportunity to get a basic blood pressure because high blood pressure can actually occur in very young people at times. And so that would be important primary prevention for that young person as they get older. Now, there is a lot of discussion out there. I suspect many of your listeners have heard about an EKG, an electrocardiogram, which is a study where leads are placed on the chest and you get a piece of paper printed out with electrical activity on that paper. It's called, again, an ECG. And sometimes that can be used for screening purposes. And there's a controversy out there that's been around for many years about should we include a screening EKG as part of this physical, this pre-participation evaluation. The issue with trying to say that's a requirement across the board is whenever you require this for everybody, of course, if you have concerns on the ECG, that's going to trigger more testing. And the ECG is not perfect. Even when we use criteria that we know we should be using to read an athletic ECG, they're what we call false positives. And again, you can imagine by forcing this on everybody, you can actually lead to testing that can be potentially harmful for that individual, could be financially harmful for the family. You're pulling athletes off the field. They could be pulled off for extended period of time. And there's still a lot of non-confirmatory data. So we don't have the affirmative data that actually tells us that using the EKG actually reduces what we're talking about here, which is sudden cardiac arrest or death. So you may identify important things, and that could be relevant to that individual, but reducing sudden cardiac arrest, we still don't have that definitive proof. And so the EKG can certainly be helpful whenever the situation is right. You have practitioners who can interpret that ECG appropriately. They know the criteria. They're not reading it the wrong way and calling things abnormal that aren't abnormal. Obviously, that's not what we want. And you want to make sure that people who are being screened are able to see those practitioners downstream if there's referrals needed or if they need certain tests, because the last thing we want to do is to actually cause harm. Nobody wants to have athletes have sudden cardiac arrest. If we could prevent every single case in the world, we would. We know that's not possible no matter what you employ from a screening test. But the last thing we want to do is to force things on people that may actually lead to that and don't necessarily reduce the primary reason why we're trying to do that. So it's a really controversial and important topic. That's why I spent some time going through that. Up front, every athlete should have some of these basic questions. As mentioned, the physical exam, the blood pressure, and then anything beyond that really should be incorporated based on other circumstances that may be at play as it relates to should we be doing this and should we not be doing that. And the more testing you add on, certainly the benefit just isn't there. Getting pictures of the heart, for example, there's just no data to support that actually improves outcomes. And for the same reasons, sometimes these things can actually lead to what we call unintended harms.
Yeah, it's kind of like a cause of anxiety instead of helping the person. So my understanding is your goal is to kind of do all these tests on the athletes that might experience sudden cardiac arrest, and then you try to determine what what is the reason that it happened. Is that kind of like what you're doing right now with your research?
Well, what we generally try to do when we're seeing athletes clinically is, of course, if it's screening, of course, you're trying to see if there's any sort of red flags. Now, if we fast forward and say there is an issue and you find an abnormality, then you do more testing and you obviously have the right practitioner seeing the athlete because you got to get the right diagnosis. Um, when you ultimately identify a cardiac diagnosis, of course, the question is this a cardiac diagnosis associated with sudden cardiac arrest? And then you have to decide, are there certain treatments that we can implement that are necessary here? But ultimately, it's a process working with that athlete, their family, the other what we call stakeholders, such as the school or the team that this athlete may be on, to decide the safety of potentially that athlete moving on and continuing to play sports. 10 years ago, we were too restricted. Any athlete who had a cardiac condition, essentially any cardiac condition, was told you can't play sports. And that's really no longer the case. And that's appropriate because risks some are actually somewhat uncertain for many of these conditions. And we were doing things not allowing the athlete to tell us what they want. What are their wishes? Let them give them a chance to let us know what type of risk they're willing to take on. Of course, the team, the school has a voice as well. And so it's a much more integrated process now using something called shared decision making. That term kind of speaks for itself. It means that you're coming forward with a decision and all parties that are relevant to the question at hand have a voice and a say, and then you work towards an ultimate outcome that works for everybody. And many times now, athletes are supported with heart conditions to play sports and accept certain levels of risk that may be present. And then, of course, our job is to ensure that all the appropriate emergency action planning, people knowing CPR, automatic external defibrillators being nearby, all of that planning is clearly well implemented when that athlete participates. I want to say one important point, though, and this is kind of going a little bit back to the screening process, maybe it ties in a little bit to what we're talking about right now, which is, and I kind of said this earlier, nobody wants an athlete to have a sudden cardiac arrest. And of course, if they do, we want them to survive. Unfortunately, that doesn't always happen. And nobody wants to have these events, whether you're a young athlete or an older athlete. But there's unfortunately nothing out there. There's no degree of screening or aggressiveness with trying to do testing before something happens to prevent every one of these cases. In fact, the most common cause of sudden cardiac death, if you look at registry data right now, are actually cases where the autopsy was normal. So structurally normal hearts at autopsy. They didn't actually have a structural heart problem. That's the most common cause identified. Now, there could be like an underlying heart rhythm problem that might have existed that was never detected. That's for sure, some of these kind of structurally normal heart autopsies, but that's not all of them. And so that's kind of the point here, which is that we can't prevent every one of these cases. And that's, I think, really important for all young athletes to hear, parents to hear. We do our best, but it is ultimately something that will never be down to 0%. We're doing our best to try to get down that as close to zero as we can. But then even for those athletes who are now playing sports and they may know they actually have something, again, we do our best to try to stratify how much risk may be present with that specific athlete, with that condition. Sometimes, or most of the time, if they truly have a heart condition, it's never a zero risk phenomenon. But that doesn't mean that the athlete still can't have a voice in this, and everybody have a voice about how much risk people are willing to take on. Sports are very important to some individuals. It's how they identify, and we shouldn't forget that. Anybody who doesn't think that that's important for an individual doesn't take care of this population and doesn't understand how this is actually a critical piece for a lot of people, and being able to pursue their dreams and play sports is a vital part of kind of what they want, and that should be integrated whenever you're trying to decide if somebody with a heart condition can continue to play sports. And that can actually include an athlete who survived sudden cardiac arrest. And there's some high profile cases out there, and we don't have to talk about them, but some of those athletes have gone back to their competitive sport. Again, it's all about going through these processes, taking care of the patient, the condition that they have, but then deciding kind of what their preferences are, trying as best we can to decipher how much risk we think may be present. And if we believe the risk isn't prohibitive to an extremely high level and everybody's comfortable with that, then many times these athletes do actually return to sports.
Based on your research, are there certain athletes that you found could be more at risk for sudden cardiac arrest?
There certainly are conditions out there that are, at baseline associated with sudden cardiac arrest, but then within a specific disease, there's different forms of risk. That's what makes it challenging, managing
And
these
I mean,
cases
like
so
the challenge
challenging.
athletes, like a football,
Oh, sorry.
a runner. That's what I mean. Like, are there certain types of athletes that you have noticed are more prone to sudden cardiac arrest? Whether that be a runner, football player, whoever.
Sure. The sport itself, obviously there are more intensive sports, and when you look at registries, you'll see certain sports kind of more commonly represented. But there's probably also other factors involved. It's never just the sport. We've learned that social determinants of health is a really important topic these days as it relates to the disparities that we see in outcomes. And this isn't just athletes, this is just in general between Black individuals and outcomes compared to non-Black individuals. So um, I believe that these same social determinants of health can also play a role as well, even when you look at outcomes for young athletes. Now, if you look at the registry data that exists, uh, certain sports, basketball is kind of at the top of the list where we see at least a higher incidence of these type events in these registries. Um, but basketball as a sport is very similar as it relates to the nature of the demands to other sports as well. It's not necessarily the most unique sport to where you would think, well, maybe basketball is dangerous. I don't think that's the case. I think it is probably more other factors that we just don't understand as to why we see some of these differences and why it's not like every sport across the board has the same reported incidents of sudden cardiac events in athletes. So
So it might not
really
necessarily be basketball as a sport itself, more of the like factors that come into play, social, different factors that come into play of the sport.
that's an opinion I have.
Okay.
Again, we need to do the research to actually understand this. We don't know why we see a higher risk among basketball players. Soccer, football have higher incidence as well relative to other sports, and so we just don't understand some of the differences. Uh, what I was trying to say was just that I think it's probably more than just thinking about the demands of the sport, and other factors that haven't been as well identified or defined that may also be related to this. So when I counsel an athlete who wants to play sports, who may have a heart condition, and I ask them what sport they play, of course, that's integrated within the decision, but I wouldn't tell an athlete if they're a basketball player, oh, you can't play because you're a basketball player, if that makes sense.
Okay. All right. So it wouldn't be like but because of the sport that you play, you can't just play that sport.
Correct. Now you have to think about the nuances within the sport, the demands of training, competition, and use that information when you're counseling them and thinking about where the risks may be present. Again, it's a very complex process when you're taking all these factors, but certainly just looking independent, just that sport in isolation, that shouldn't be a kind of deal breaker in and of itself. You need to think about all the factors. And then in addition to that, what their disease is like. So as an example, there's a genetic heart condition out there that's called hypertrophic cardiomyopathy. Some of your listeners may have heard of this, and it's a genetic heart condition where ultimately the heart becomes abnormally thick. But this condition doesn't look the same for everybody. It's got thousands of probably different ways that it can look, what part of the heart is thicker. And for each individual, the disease may evolve differently between individuals. So it's a very, it's just not a disease that looks the same for everybody. And so based on what that disease is like for a specific athlete or patient is going to potentially guide where you think their risk may be. So you're looking at the complexities there, of course, the complexities about how they train and what sport they play. You're taking into all these factors and you're trying to counsel that athlete.
A lot of the elite athletes, they push their bodies to the extreme limit. Is it possible that doing that so much could put you more at risk for sudden cardiac arrest?
That's another good question. I don't think that just based on if you're a professional athlete or an Olympian, um, we're going to take into account again, certainly the differences in training and potentially differences in intensity when they train and maybe during competition as a way to integrate that when we're counseling them. But again, I just don't want people to think that you take all these things in isolation in terms of telling somebody they can or can't play sports. Obviously, it's a factor, and you do take that into account. Um, but I wouldn't say that if an athlete is at a more elite level, I'm going to be more restrictive for them. Absolutely not. It's really still very much on an individualized athlete to athlete basis as to how you manage them, counsel them, and work with the different stakeholders that are involved with that athlete when you're trying to guide them through whatever sports that they want to continue to play.
And I guess kind of what I'm getting at there. Have you heard of the gym orange theory? Like they have different colors for like how hard you're working out, and like that's based on your heart rate. So like when you get to the red zone, your heart rate is very high, and they consider that like the highest level. Whereas the orange zone is kind of like the zone that you want to be in. So I guess that's kind of what I'm asking. Like if you're constantly going to that red zone where
I see.
your heart rate is like 180, 200, depending on, your fitness level. But like if you're constantly going to that red zone, is that bad for the heart? Could that make you more prone to cardiac arrest?
I see your question. It's a great question. So when we risk stratify athletes, we absolutely do have them engage in, and this is an important critical part when you're taking care of an athlete on the sports cardiology side, to do exercise testing and push those athletes to a maximum level of effort. And we try to mimic their sport as well. So in my exercise lab, if you're a cyclist, we have a bike in my exercise lab. If you're a runner, we have a treadmill. If you are a sprinter or a basketball player, we'll do exercise testing on a treadmill, and then when we're done, we'll have them do sprints, kind of mimicking what they do for a basketball player, say on the court, or a soccer player. And yes, you want to see whenever you maximally exert themselves, particularly at that max intensity level, are you observing anything abnormal? Because many times athletes will present with symptoms during sport. And we are guilty in general cardiology of doing exercise testing because most of the patients in the general cardiology space aren't elite athletes. And a lot of the exercise protocols, you only have to get to a certain heart rate, generally 85% of a calculated max heart rate. And once you're there, you kind of say, okay, we're good. Really, the test is normal. You do that for an athlete, you're totally missing the boat because they are generally getting themselves to 100% of their max heart rate. You want to make sure that nothing untoward is happening at that level. So that's a critical part. Now, if you're a healthy athlete or a healthy individual and you're engaged in high intensity exercise, that itself doesn't lead to problems. Meaning like, because I get this question a lot in my clinic. Oh, Dr. Kim, I'm always in the red whenever I'm at Orange Theory, as you said, or I'm pushing my aim for my max heart rate. I do it.
Like totally out of breath, can barely breathe. Is it possible to push yourself too hard too often?
I think the answer to that is no. Now, absolutely, in certain circumstances, if you have a cardiac condition, we may find that a max level of intensity may be stressing the heart a little bit too much, like a individual with coronary disease who's had a prior heart attack. And there's things that we look for that could cue us into maybe backing yourself down and being not fully anaerobic and at max intensity. That's a bit of a happier and a safer exercise prescription zone for you. But for the healthy athlete, or if an athlete is symptomatic, but when we push them to the max, we're not seeing anything, then we're very reassured. And for that healthy master's aged athlete who comes in and just asks that question like you did, like, is it bad for me to do this? My answer is no, it's not.
Yeah, I'm thinking about my
Intensity.
times too, like, because I work out a lot, and they say get to hypertrophy, like work out until like you can't anymore. But it's like, well, I want to keep my heart healthy too. Oh, I'm not an extreme athlete, but
High intensity training is actually a good thing. So people who mix in with kind of long aerobic efforts, mixed in with high intensity efforts, obviously resistance exercise as well. If you're doing all those type exercise type activities, that's actually good. Not just doing one thing. If all you do is just weight lift, probably want to introduce a little bit of aerobic exercise, so you're going to get some benefits by doing the aerobic exercise. And similarly, if all you're doing, going out on long runs, actually doing some weights and some resistance training's got additional positive benefits. So that's generally how we counsel really anybody. And then of course, for the athletic individual, again, just to solidify the answer, for the healthy athlete with no concerns, pushing yourself and doing these high intensity efforts, getting yourself to a max heart rate is okay.
But if you've had a cardiac event or maybe a family history or anything, then maybe talk to your doctor about it, about going to the all the time.
That's probably the best way to say it, because some of those people can. They certainly can.
Yep.
But you want to
Right,
make
your
sure
doctor,
that
cardiologist, whoever, and see what they recommend. Okay, I only have a few more minutes because somebody needs to use this room after me. So are there any other take-home messages you want to share?
probably just summarizing very quickly some of the salient points that you and I discussed. Number one, if you're older and you're an athletic individual, remember exercise is medicine. Doing what you do is good. If you're seeing a doctor and the first thing they tell you is to stop running marathons, they're bad for you, you got to find a different doctor. Now, it doesn't mean that marathon running is great for everybody, but the point is that that's just somebody who probably doesn't understand kind of the reason why you're doing that in the first place. And running marathons, for probably the vast majority of people who run marathons, has other benefits. They're engaged in the habit for reasons other than just doing exercise for health. And that needs to be supported and acknowledged by any practitioner that's caring for you. Otherwise, they're in some respects disrespecting some of the things that you're passionate about. Now, that doesn't mean if you exercise a lot that this is a cover for non-heart healthy habits. And so this is why there should be a focus on living heart healthy, focusing on making sure your blood pressure is good, you're eating right, and seeing your doctor regularly just to make things like everyone else, just to make sure all this is okay. Obviously, if there's a concern from a primary prevention standpoint, then they'll move you on and potentially see a sports cardiologist. For the younger athlete, you want to pay attention to concerning symptoms when you're exercising. If you are feeling chest tightness during exercise, if you passed out during exercise, feeling your heart racing appropriately, those are the things to bring up to your trainer. And probably that does require being assessed. For those who have questions about screening, you absolutely want to make sure that you're having a good, thorough history and physical as a pre-participation exam. And if other tests are employed, just make sure that whomever is overseeing that you feel comfortable that they have carefully thought through all the additional tests that they may be offering. And it doesn't mean that everybody has to have this. There are those key things that I mentioned earlier in this podcast discussion that have to be recognized and checked off rather than just saying, hey, let's just do this on everyone without carefully thinking through the process.
All right. Good information to take home. Well, thank you so much, Dr. Kim, for joining me, discussing all of this. I think it's really useful. I think we still have a lot to learn, though. A lot of questions still to get answered, it seems like.
Absolutely. Thank you so much for having me.
Thank you.
Thank you, everyone, for tuning in to this edition of the Wellness Files with Kari Beal. If you like what you hear, make sure to comment. You can follow the podcast on Spotify and on Apple. If you like it on YouTube, you can save the playlist so you can watch every episode as we release them. Again, we release episodes on every Wednesday, and thank you so much for listening.